Topic is vertebral column and joints of pelvis. So in this we discuss the competency, that is describing the curvatures of the vertebral column. Vertebral column is the flexible column made up of series of vertebrae. In human vertebral column, there are 33 vertebrae divided into cervical 7, thoracic 12, lumbar 5, sacral 5, fused and coccyx can be 3 to 5 segments. It is part of the axial skeleton. It has two columns, an anterior column which is a solid column of vertebral bodies and is compression resistant, and another column is posterior column which is a hollow column of neural canal and is tension resistant. It has facets that resist rotation and anterior displacement. Line of gravity. The line of gravity of the human body passes through the auricle of the ear, odontoid process, body of 7 cervical vertebra, anterior to thoracic spine, then posterior to L3, and it falls between mid-femoral heads. Coming to distribution of the body weight, the upper body weight is then distributed to the lower extremities through the sacrum and pelvis. This reduces the amount of work required by the spinal muscles and eliminate muscle fatigue and backache. Coming to curvatures of the vertebral column, thoracic and sacral curves are termed primary curves because they are present in the fetus. Cervical and lumbar curves are compensatory or secondary curves and they develop after birth. Cervical curvature forms when the infant is able to hold its head, that is about 3 to 4 months, or sits upright, that is about 9 months, at about 9 months. Then lumbar curvature forms later from 12 to 18 months when the child begins to walk. Abnormal curvatures of the spine occur in certain pathological conditions, that is hyperkyphosis refers to the abnormally excessive backward curvature, that is more than 45 of this spine, that occurs in the thoracic or sacral region. It is also called round back or Kieslo's hunchback. It is a condition of unknown cause. Vertebrae grow unevenly in the sagittal plane, resulting in wedging shape of the vertebrae, causing kyphosis. Other cause of kyphosis, because of slouching, and is called as postural kyphosis. Nutritional deficiencies during childhood such as vitamin D deficiency, that is rickets, and tuberculosis causing gibbous deformity, and there are other congenital causes. Lumbar hyperlodosis. Lumbar hyperlodosis refers to excessive forward curvature of the lower back, commonly called as hollow back or saddle back. Common causes include rickets in children, tight low back muscles, excessive visceral fat, and pregnancy. Scoliosis. Scoliosis is lateral curvature of more than 10 degrees to the right or left, is the most common abnormal curvature, occurring in 0.5% of the population. The standard method of assessing the curvature quantitatively is measurement of the angle that is called as Cobb's angle. Cobb's angle. It is the angle between two lines drawn perpendicular to the upper end plate of the uppermost vertebra involved and the lower end plate of the lowest vertebra involved on a plain radiograph. It is more common among the females. May result from unequal growth of two sides of one or more vertebrae so that they do not fuse properly. Causes of scoliosis. It can also be caused by pulmonary atelectasis, that is partial or complete deflation of one or more lobes of the lungs as observed in asthma or pneumothorax. It can be sometimes associated with other conditions like Marfan's or Prader-Willi syndromes and is often subclassified as syndromic scoliosis. Kyphoscoliosis. It is a combination of kyphosis and scoliosis. It can be seen in syringomelia, Friedreich's ataxia, Duchene's muscular dystrophy due to the asymmetric weakening of the paraspinal muscles. Then we go on to describe type, articular ends, ligaments, movements of intervertebral, sacroiliac and pubic symphysis joints. First we will start with intervertebral joint. Each vertebra consists of body in front and vertebral arch behind. Superior and inferior articular facets project from this vertebral arch at the junction of the pedicle and the laminae. Articulation of the inferior articular facets of one vertebrae with the superior articular facets of the vertebra below form the apophyseal joints. Intervertebral foramina is formed by the vertebral notches of the adjacent vertebrae. It lies anterior to the apophyseal joint. Vertebrae are bonded anteriorly by the disc and the anterior and posterior longitudinal ligaments. Apophyseal joint with its capsule together with the supraspinous and interspinous ligaments, intertransverse ligament and the ligamentum flavum complete the bonding posteriorly. Muscles which produce movement at these joints can be considered in two groups. Larger and longer muscles are more superficial group, then the shorter muscles are in the deep group. Shorter muscles affect movements at the individual intervertebral joints. Then position of the interspinalis, intertransversi, multifidus, rotators muscles of the deep group in relation to the vertebrae makes it clear that fine movements can be controlled by these joints. Sacroiliac joints. It is the largest axial joint in the body. There is a wide variability in the adult sacroiliac joint encompassing the size, shape and surface counter. It is most often characterized as a large auricular shaped diarthroidal synovial joint. Anterior third of the interface between the sacrum and the ilium is a true synovial joint. The rest of the junction is comprised of an intricate set of ligamentous connections. Because of an absent or rudimentary posterior capsule, the sacroiliac ligamentous structure is more extensive dorsally. The main function of the ligamentous system is to limit the motion in all planes of the movement. In women, the ligaments are weaker, allowing for mobility necessary for parturition. Pubic symphysis. Transverse width of the symphysis increases from posterior to anterior. Anteriorly, the ligaments are more abundant than posteriorly. Symphysis is made up of hyaline and fibrocartilage. Abnormal separation of the pubic symphysis are related to extrophy of the bladder and epispadiasis. Other less common abnormalities of the urogenital and anorectal regions. These abnormalities are seen in childhood, but the patient may survive into adulthood. Delay in the closure of the midline bone structures from skull to symphysis pubis is recognized as cleidocranial dysostosis. This delayed ossification may give the appearance of a wide symphysis in children. During pregnancy, symphysis pubis avoidance, Williams reported that the average width was 7.1 millimeters in a large number of pregnant subjects as compared to the average 4.1 in non-pregnant women. Thank you.